and welcome to Medical Dialogues. I'm Anshika Mishra. Let's look at today's top medical news. Global review links common viral infection to higher heart attack and stroke risk. Scientists have confirmed that several common viral infections significantly increase the risk of cardiovascular disease, including coronary heart disease and stroke. A comprehensive systematic review and meta-analysis published in the Journal of American Heart Association synthesized data from 155 studies, demonstrating that viruses such as influenza, COVID-19, HIV, hepatitis C, and shingles are linked to both short and long-term elevated cardiovascular risk. Cardiovascular diseases remain the leading cause of death globally, traditionally attributed to factors like high blood pressure, smoking, and poor diet. However, this study highlights viral infections as important, often overlooked triggers, which induce systemic inflammation causing endothelial damage and increased blood clotting. These mechanisms can rupture atherosclerotic plaques, precipitating heart attacks and strokes. Researchers conducted extensive literature searches across 5 scientific databases, including Medline and Web of Science, identifying over 52,000 records published up to July 2024. Screenings and quality assessment resulted in 155 relevant studies, which comprise cohort, case control, and self-control case series designs. Lower ketone level and improved exercise capacity may aid diabetic ketoacidosis management, according to a study. Scientists at the University of Houston have released a promising new approach to managing diabetic ketoacidosis, a dangerous complication affecting about 20 to 30% of diabetic patients globally. Their research, led by Assistant Professor Ravi K. Singh and published in EMBO reports, focuses on the muscle-specific protein isoform MEF2D-alpha-2, which plays a key role in regulating skeletal muscle metabolism of ketone bodies and exercise capacity. DKA arises when ketone levels in the blood become excessively high, leading to toxicity. While ketones serve as an alternative energy source during low carbohydrate intake such as ketogenic diets, excessive accumulation can be life-threatening, particularly in diabetic patients. Singh's team discovered that MEF2D-alpha-2 influences how effectively skeletal muscles oxidize ketone, impacting both systemic ketone level and exercise endurance. Using advanced CRISPR-Cas9 gene editing, the researchers specifically disabled the MEF2D-alpha-2 isoform in muscle tissue. They then measured the expression of enzymes involved in ketone mechanism and assessed physical exercise capacity in experimental models. Daily kimchi intake linked to reduced BMI and belly fat, study finds. Scientists have found that moderate kimchi consumption may help reduce obesity risk, reaffirming the health benefits of Korea's iconic fermented dish. A large-scale study of over 115,000 Korean adults published as part of the Health Examines, that is HEXA study, explored how eating kimchi relates to body weight and abdominal obesity, providing robust evidence for the probiotic power of this popular food. Kimchi, made primarily from fermented cabbage or radish with spices like garlic and chili, contains lactic acid bacteria shown in lab studies to reduce fat accumulation and enhance metabolism. This study assessed dietary habits and health data of adults aged 40 to 69 using food frequency questionnaires and physical management like BMI and waist circumference to define obesity and abdominal obesity. Researchers analyzed self-reported kimchi intake across varieties such as bechu and kakdugi. Obesity was defined as BMI more than 25 kg per meter square, with abdominal obesity characterized by waist circumference above 90 cm for men and 85 cm for women. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.